Hi, my name is Suzanne Bernier Robinson. Welcome to Get the Facts. Today we're going to be talking about influenza. I have Chris Adamski here today, Peter Sebeny, and Garrett Simonsen. Would you take a minute and talk about the respective roles you have at the agencies that you work for?
Sure. Good afternoon, and thank you so much for having the show today. It's important. I work in infectious disease for the state public health department, Department of Health and Human Services, so overseeing a number of different activities that relate to infectious disease control and surveillance. So happy to be here to talk about flu.
And influenza, or the flu, is one that I'm sure is really key.
And it's very timely. Yes.
Perfect.
Yeah.
And
great. Yeah, thanks again for having me here as well. I'm an infectious disease physician at Parkland Medical Center and at Portsmouth Regional Hospital as part of Appledore Medical Group. I also, just as I do outpatient consultative services, I see a lot of inpatients for which infectious diseases consultation is requested, and I also oversee a lot of the infection prevention and control efforts at Parkland Medical Center.
Okay. And Garrett.
And my name is Garrett Simonsen. I'm the Public Health Network Coordinator based out of the Derry Health Department. My primary role in the Derry Health Department is to coordinate regional efforts to prepare for public health emergencies and threats. So in particular, infectious disease threats that are naturally occurring or perhaps intentional in the case of bioterrorism.
So what is the flu? I guess that's the big question.
Well, I think first and foremost, it's a virus. Influenza is a virus that causes a respiratory illness. Typically, those symptoms are fever, cough, sore throat, sometimes maybe a runny or congested nose, achiness. It's not always precisely, you can't tell sometimes the difference between a cold and flu. They both cause a respiratory illness. Flu tends to be a little more severe, but not always. Sometimes you might have some uncomfortable stomach distress as well, particularly in children when they have influenza, but by and large it's a respiratory illness that causes predominantly fever, cough, and sore throat.
So with it being a virus, usually antibiotics aren't prescribed or anything like that. You just kind of let it take its course. Is that
that's correct? That's correct, yes. Flu really should represent influenza, which is a specific name of a virus. The word flu is often misused to describe a lot of different infectious disease syndromes that usually are associated with the virus, things like the common cold, the viruses that cause the common cold. That is not influenza. But with regards to antibiotics, no, there is an antiviral medication that can be used to treat influenza, and most doctors are aware of that treatment and when should it be used. But generally, obviously, antibiotics would not work against a virus. However, with that being said, certainly with severe influenza, that can be complicated by secondary infections, and some of those infections can be things like bacterial pneumonia, for which antibiotics would be necessary. But most oftentimes those patients are hospitalized, and that's how often we end up seeing a lot of these patients.
So how do you know if you have influenza or a common cold? I mean, are there distinct symptoms that really earmark themselves as influenza?
I think, as we said earlier, influenza generally comes on as a sort of a rapid onset of fever, usually in addition to sore throat and cough. To distinguish that from other illnesses, really, it takes a clinician, and I think the problem with influenza is there's not really a simple, accurate test that can be done at the bedside. There are some rapid testing for influenza that's available in the emergency rooms and the outpatient settings, and if they're positive, certainly that represents that that patient does indeed have influenza. But if it's negative, it doesn't always indicate that you do not have the flu. So sometimes it is difficult to tell.
So with the rapid onset, are you talking like within 24 hours you've got a headache, and all of a sudden 24 hours later your throat is sore, your chest, you're coughing?
Correct, yep.
Okay.
Usually,
that quickly?
Yeah, the onset usually, that whole syndrome usually develops at its maximum within 3 days. So it happens pretty quickly.
So how is it spread? If I have influenza, is it something that just, I'm sure if I'm coughing, that's a sign that it's, I'm assuming it's very contagious, and that's why we've got the vaccine for it.
Well, it is, and certainly Dr. Sebeny can comment as well. I think, it's respiratory secretions, and you always hear people, using good respiratory etiquette, good cough etiquette, so coughing into a tissue, washing your hands, washing your hands often and consistently is good practice in general to prevent many illnesses, including influenza or flu. But it's, it's those in the respiratory secretions, coughing, sneezing, that's how influenza is predominantly spread.
And just to double check, is coughing into the what is the proper etiquette for coughing these days? Is it into the elbow and the arm, or?
I mean, you hear, it's into your elbow. It's certainly not coughing in someone when you get into somebody's space or face and coughing. That is obviously more likely to cause, that person to become infectious as well.
That's a very good question, and you see this a lot in public. You should never cough or sneeze into your hand, and you see a lot of people do that. So if you don't have a tissue, yes, you should, cough down or sneeze down, ideally into your elbow or something like that. We don't always have a Kleenex, and then obviously if something happens and you are sneezing on or coughing and you think your hands are covered, you should go wash your hands with soap and water, or at least use an alcohol gel-based hand sanitizer.
And that's why it's so important to teach the children at the early age those keys of coughing and sneezing.
And generally, we see them being the best practitioners of that. When you're out in the community, those are the folks that you see practicing the best cough and sneeze etiquette. And certainly we aren't suggesting that Kleenex isn't an option anymore. But when you're using that Kleenex and disposing of it, there's still the need for washing your hands. And so hand washing is important. Soap and water. In the schools, we teach the 20 seconds at least. So sing happy birthday to yourself.
That's, I was going to mention that. I learned that the other day from you.
But also when hand washing using hot water or warm water and soap isn't an option, there are alcohol-based hand sanitizers that help to clean the hands and eliminate the virus. So switching back and forth between alcohol-based hand sanitizers and hand washing is an effective way to help reduce the spread of influenza.
So why do we usually see influenza during the winter months? I mean, it's viral, so is the virus, you would think a virus would be killed during the winter months, or maybe that's more the bacterial stuff.
I think, certainly flu can circulate all year round and typically does, but it's more commonly and more notable, the influenza activity is more notable typically between October and May. That's what we might commonly refer to as the flu season.
And that is not just regionally, is it countrywide, or does it work its way across the country?
In our country, typically flu season, or what we commonly refer to as flu season, most often is between October and May. The most common months where we see an increase in activity, but not exclusively, is usually January, February.
Correct. I'll just add one thing for those people who travel frequently. For example, if you're in the southern hemisphere, the peak activity for influenza is during their winter months, which in the southern hemisphere is the opposite of the northern hemisphere. And as you go closer to the equator, it's actually probably more of a year-round transmission. So it's different depending upon where you are in the world, so to speak.
Okay. So how serious is influenza?
Well, flu can be certainly very serious. As was mentioned, I think there can be significant complications of influenza, and certainly hospitalization may occur and death can occur. So it can be a very serious illness, and I think that's further reinforces the importance of vaccination. Someone who may be more susceptible to complications, someone who has underlying health conditions, but there can be healthy individuals who get influenza who have a very complicated course of illness.
Really?
So it can be a very serious illness.
So it's just a matter of the course that it takes once you contact that?
Well, and I think certainly any virus or bacteria can become more complicated, as was mentioned. Dr. Sebeny mentioned pneumonia could be a complication of influenza. So you don't know for sure, certainly, and that's why I think vaccination is so important to either prevent the complications and maybe someone has a shorter course or less complicated course of illness. Hopefully prevent it 100%, but we know that doesn't prevent 100%, but certainly can help with a shorter course of illness and less complicated. We don't want people in the hospital, but that certainly does occur every year. Right.
And so is it a result of people not getting the vaccine? I mean, how does the pandemic happen with, I know a lot of people are recommended to get the vaccine, but is it the type of virus that is spreading quicker, or is it the lack of people getting vaccines? How does that happen?
I can answer that. So, you know, the influenza changes every year, actually, and we try to predict what are going to be the most likely strains that circulate. And actually, in any given year, there could be several different strains that circulate within the country, and that's part of the guessing of when they manufacture the vaccine for that year. But because the influenza virus changes, it really, the severity can also change, and who is immune and who is not immune. That can vary, you know, year to year. And when you see these large pandemics, it's usually due to a major shift in the mutations that occur in the virus. In other words, every year there's small changes that happen, but then on other years a major change can happen, something called the antigenic shift, and that can cause a sort of a newer virus that hasn't been seen in previous years, so to speak, and then that can really cause a lot of infection, a lot of morbidity and mortality. You know, one such example is the 2009 pandemic H1N1, which we're still seeing circulate around this year as well, but in 2009 it was really a novel strain of virus that caused a lot of sickness.
I remember that. So we talked about the hand washing, proper coughing into the arm. What other measures can we take to protect ourselves from getting influenza?
Well, I think outside we can certainly talk more on vaccination, but I think the other thing, you know, if you are sick, staying home from work and from school, because you're not putting yourself with other individuals who may be susceptible, or you know that you're hopefully preventing any further transmission. When we start to see a lot of influenza activity or flu is circulating widely, it's still not too late to get vaccinated. But you know, there's certain measures, and they're called sort of community kind of mitigation measures, in which, you know, that if you stay home from work or school, and usually you don't feel very well at all, and you should stay home. But when you're doing that, I think you're helped from preventing further transmission to your coworkers, to schools. I mean, we don't want to see outbreaks of illness, particularly in schools or anywhere for that matter.
So mostly that is how it occurs. It's just spread through the coughing and the secretions.
It is. I mean, we see flu activity that happens every year, and we, you know, we've always said, and I think we'll always continue to say, we can't really predict with any degree of certainty what's going to happen every year. What we do know is we'll probably see some level of flu activity, and so that, I think, reinforces, you know, to get that vaccination every year, as was mentioned. I think you know, each year you want to have that protection. It doesn't last from year to year. There's some loss of that protection. So annual vaccination is really one of the primary ways in which you can protect yourself.
Chris talked a lot about direct contact with the virus from uncovered respiratory secretions when we cough or sneeze, but also there are indirect ways that we can come into contact with the virus on surfaces. So if someone's coughed or sneezed into their hand, and then they touch the doorknob, and I come along and touch the doorknob after them, and then I'm touching my eyes, nose, or mouth, having not washed my hands first, I can come into indirect contact with the virus in that way. So, you know, often on a community level, in the schools, we talk about the importance of washing our hands before we're going to, you know, eat or rub our eyes or come into contact with our eyes, nose, or mouth. You know, certainly we try to discourage the sharing of utensils or the same drinks. That's another way that the influenza virus could be spread as well. So.
And I imagine that it's just a really microscopic little virus, or
Yeah.
I don't even know, what is it called, that you would touch, and that's all it takes.
Yeah, it's the virus particles basically, and they can be carried in respiratory droplets, so they actually do get aerosolized when you cough and when you sneeze. And
Okay.
as Garrett said, they can live on surfaces actually for up to, we think up to 8 hours in general, 2 to 8
Oh,
hours.
wow.
So it is important to, you know, use good hand hygiene, and, you know, if you have somebody sick, you know, to make sure that, you know, appropriate measures are taken, you know, where they're sitting or what have you, to clean up those areas. And then, you know, with person-to-person contact, generally we say, you know, because they're transmitted via these droplets, we, you know, generally in terms of sort of isolation control, we want people to stay, you know, 6 feet away or further, generally speaking, because that transmission can occur even within 3 feet of a person. So.
Wow. So maybe you can explain a little bit about what a vaccine is and how is it formed and why is it a good thing. You've told us why it's a good thing, but maybe a little bit about, because I know sometimes people are concerned that they may get the flu by having the vaccine. So maybe that, I don't know if that's a myth or...
Sure. I can answer that. So, you know, the vaccines are usually made by, you know, propagation of the virus or bacteria. In this case, we'll speak specifically regarding influenza. Usually the virus is propagated, but the virus that is used to make the vaccine is inactivated, usually killed, or using particles that cannot allow the virus to reproduce or cause an infection. But they try to use proteins from the virus that will allow your body to almost mimic the infection, so to speak, so that you can form an antibody response. And that's a very, very scientific method that's done, and there's many new technologies that are actually being undertaken. Even in just this past year, there's new vaccines that are generated through new techniques that don't even rely on, you know, egg-based culture, because a lot of the viruses, when they propagate them in eggs, which is why in some cases people with egg allergies, there's some
you mean
concern
like
for allergies.
real eggs, like chicken eggs?
Yep,
not
chicken
little-
eggs, yep.
Yes.
I mean,
Exactly.
there's so many types of eggs. I was just trying to think, what
Right.
kind of eggs?
Yeah, exactly.
Oh, really? Okay.
Exactly.
So someone who may have an egg allergy, should they be concerned if they're going to have a vaccine?
If it's a severe, if they should talk to their doctor. If generally egg allergies are not an absolute contraindication to the vaccine, the traditional vaccine that even is generated in eggs. If it's a severe allergy, then yes, they should avoid the vaccine. However, there is a new influenza vaccination that's actually completely egg-free. I don't know how widely it is available currently in the state of New Hampshire, but there is sort of an egg-free vaccine, if you will. So really, even if you have a severe egg allergy, there are methods to get vaccinated.
Okay. And I would hope that most people who have an egg allergy know that they need to be careful with a flu vaccine. I would have had no idea.
Well, they do. When you go to get your vaccination, they educate you and you read specific information regarding it, and they'll always ask before you get it.
Oh, that's great. Okay,
And that should
good.
always be the case, whether you get it in a clinic setting or if you get it at your local pharmacy.
There's a vaccine information sheet that every individual is provided that gives them all the basic
Correct.
information, and so that's very helpful, I think. And as was said, I think you always want to consult certainly with your healthcare provider.
So once you have the vaccine, how long does it take to kick in? And I'm sure it's not immediately. You still need to, maybe there's a period of time before you would be immune to getting the flu.
We think it's about 10 to 14 days
Oh, wow, that long.
to actually get protection. That's why you should get it earlier, early in the season as soon as it's available. That's why you see all the pushes in late September, early October to get the vaccine, because it does take some time to build up immunity to that vaccination you receive.
So once your body starts building up that immunity, how long does it seem that the vaccine will work? Is it a couple of months that...
That's a very good question, and I'm not sure we actually know the answer to that, because it does protect you. Ideally, when we want to go for 60 to 70% or greater protection against the circulating vaccine, we think it does protect people for that entire season. There likely is additional immunity beyond that, but as I mentioned before, what happens is the virus usually changes a little bit year to year. So it's actually hard to say. I mean, I think getting vaccinated every year is a great insurance policy, you know, to build up antibodies against a lot of different flu strains.
Right.
And so I think even a vaccine you get this year might have protection against other seasonal flu strains, but it's hard to sort of determine that.
It makes sense, though, if your body is building up antibodies for the flu this year, that there would be some antibodies still within your system that may be effective next year, or at least make you a little bit stronger to fight what strains are out there.
But the important thing is really that unfortunately, because there's so much changing of the virus year to year, that we still recommend annual vaccination.
Are there any side effects that people need to be concerned about if they do get the vaccine?
I think, you know, one of you mentioned sort of the myths around getting the flu, and was mentioned, you know, most commonly there's a little soreness or maybe a redness at the injection site. You know, as was Dr. Sebeny mentioned, you know, your body's sort of mimicking, it's sort of building that protection, maybe a little achiness or something that might be perceived as, oh no, I have the flu, but it really is your body kind of working to protect your body against influenza if you are exposed to it.
And I'll just add, the other thing, that's a very good point, and the other thing that actually happens is when people get the vaccine, it's already, you know, October, November, and there's so many other circulating upper respiratory illnesses. And so in that, you know, people always relate things in time to being causative. And, you know, you can get a vaccine one day and 2 weeks get a different virus altogether, and the patient's going to have a hard time, you know, separating out the two, because other than influenza, there's plenty of other circulating viruses around in the wintertime. So, you know, I use that to counsel patients and saying, no, you know, yes, you'll talk to some people who get a viral illness, a significant one, you know, that they relate to the vaccine, but it's definitely not related to the vaccine. It's probably something else they picked up because of the time of year and more people congregating together.
And I think people don't realize that there's distinct incubation periods.
Correct.
For certain viruses. I mean, it may be a week, or, I mean, I remember, I think chickenpox is like a week to 21 days, or so, you know, there's, correct me if I'm wrong, but I know that there's that's a long incubation period.
Well, influenza is a little different because it's quite a short incubation period. It can be as early as 12 hours, but generally we say 1 day to about 4 days.
Wow.
But most people, if you have the exposure to someone who has known flu, it often will be within the first 2 days.
Okay.
So it can really,
so it is quick.
It really occurs quickly.
How are the vaccines administered? You mentioned a shot and maybe redness at the site. Are there other methods that people can have the vaccine?
Well, there's the flu mist as well, which is inserted intranasally.
Okay, so it's just a squirt or two. Okay, so I'm sure that may be good for children. Do children get it that way?
So the intranasal vaccine is available. It's generally available for sort of healthy people between the ages of 2 and 49 years old. Should not be used in pregnant women. But generally speaking, it is for, you know, a healthy adult. It is a good option, particularly those people who are adverse to you know, an injection.
Is it just as effective?
Yeah, we think it is just as effective. Yep, in general, yes. Yep.
So you talked about 2 to 49 years of age for the intranasal.
Correct.
But what ages would you recommend for anyone to get a vaccine? Or are you recommending everybody?
Well, you know, anyone beyond 6 months of age is a candidate for influenza vaccination.
Really, that even the
absolutely,
young.
absolutely. You know, and guess what? It's the real young of age and the older folks who are at the highest risk of having severe illness. So those children need to be vaccinated, and our retirees, our older folks need to be vaccinated as well. So it really is for anybody greater than 6 months of age.
Okay.
Right.
And
in addition to the intranasal, in the past couple of years, they've also introduced an intradermal form of the vaccine, which utilizes a much smaller needle than the intramuscular injection. So for individuals who maybe have aversion to needles, which I think a lot of people would say that they're not crazy about needles, but the intradermal version is basically just a very small needle placing the vaccine underneath the skin.
Exactly. Yep.
okay. So that may bring some folks that are a little bit shy of the needle to realize that there could be a shot isn't that painful, really, but if they have an aversion to needles, that would be helpful. So is it ever too late or too early to get a vaccine? You know, in the season, is it too late to get a vaccine now? Or, you know, if I got a vaccine in September, was that too early?
No, I mean, for those who haven't been vaccinated yet, they should consider a vaccination and talk to their doctor about it. We generally talk about a flu season, so to speak, but when you look back at 2009 and that pandemic really didn't take hold in this country until April and May. So we sort of talk about that peak season, but really flu transmission can occur year-round, so it never is too late to get the vaccine. On the contrary, actually, the vaccine usually is not available, so that it's technically too early. It usually doesn't come out until the summer of that vaccine year.
So, and we did talk that maybe some of those antibodies would still be in your system next year. So I guess it probably is never too late either. I mean,
correct.
If those antibodies are building up in your system.
Correct. And like I said, right now, usually in this part of New England, it really does start to peak in January to March timeframe. So it certainly we're probably still have a lot of flu incidents to deal with this season. So it's not too late.
Garrett, what is the public health network's role in?
Sure. So during the traditional flu season, our focus is largely around promoting healthy activity. So hand washing, cough, sneeze etiquette, staying home when you're sick, and certainly promoting vaccination. In terms of the public health network's role, we do a lot of work around coordinating multi-jurisdiction, multi-agency planning for those scenarios when we experience a pandemic, like we did during the 2009 to 10 H1N1 pandemic. So we do a lot of work with the hospital, with Parkland, with our state partners, to be prepared to administer emergency vaccines. So during H1N1, we ran a number of clinics in what are called point of dispensing or pod sites. So we have designated emergency response facilities in this region for public health threats, where we could dispense medication or administer vaccines if the public is at risk. So that's a primary role and a primary concern. We also work with the hospital to do medical surge planning. So in a particularly severe pandemic, it may be that the hospital is overwhelmed with patients who have respiratory infections. And so we do work to plan for alternate facilities where we could help absorb some of that patient surge from the hospital and provide patient care. So actually in this month in February, we're going to be doing an exercise at our designated facility for a medical surge event to practice providing supplemental oxygen to patients who are affected by an event like a pandemic.
So this exercise that you're going to be doing, there'll be nurses and staff actually that are available to come to a different location if there's an overflow at the hospital and actually care for them in as sterile, I guess, an environment as you can create wherever that location is.
Right. So, sort of imagine a school gymnasium where, much like an emergency shelter where we set up cots for people to come and stay overnight. Only in this scenario, we'd be setting up cots to care for patients, and in particular, for this exercise, we're looking to demonstrate the capacity or the ability to set up and provide oxygen to patients who would be coming to this alternate site.
Okay, so they may never even get to Parkland, that they would just be recommended to go straight to.
Right, they would be generally a lower acuity patient who is too sick to be at home, but isn't at a sickness level or have respiratory distress to the point that they would need to be in the hospital.
Right.
And those types of exercises are incredibly important, you know, to
Correct.
practice and to be able to, you know, think through some of the process, some of the setup, and they're so incredibly important. We don't like to think about bad events that happen where, you know, many people are ill, but the reality is that could happen, and we need to be able to practice through and think that through,
I think
how
it's
that would work.
wonderful. I mean, and it should be a comfort to the town to realize that these measures are put in place should something happen, that we're prepared.
Right, exactly.
Because from what you've told me, that flu can spread pretty quickly.
Right, and we're all at risk. I mean, you know, as healthcare workers as well. I mean, it behooves us to be vaccinated every year. Certainly, I am, without question. So is my family. And you know, healthcare workers, emergency workers can come down with the illness, and that's somebody, you know, who is really going to be unable to respond.
Right, that's one
So-
less person to care for me when I'm sick.
Exactly.
If the doctors or I know that our firefighters are all in town, our paramedics, EMTs, and they're exposed to, I mean, all the medical calls they go on. So it's important to keep those people healthy.
Right.
You know.
Correct.
And we've talked about vaccination and the importance of it and the different formulations. There's lots of choices out there if you maybe don't want to have a needle or different preparations. And I think, you know, the other thing is it's very convenient now. You can go to a pharmacy. You
Right.
can certainly go to your healthcare provider's office. So there's a lot of convenience and a lot of opportunities. So it makes it very easy, I think, and very available for everyone to consider.
Garrett, you and I were talking about a website that people could go to where they would be able to search for flu vaccine locations in the
Sure.
area.
Yeah, so flu.gov, so flu.gov, is basically a one-stop shop for information about influenza vaccine, and a search engine to look for pharmacies or clinics that are offering flu vaccine. And I think it also allows you to identify whether or not they have a particular vaccine type. So if they have the intranasal.
Oh, great.
But it's always best to just call directly first to make sure that they have the type of flu vaccine that you're looking for.
So are you seeing the strains of virus for influenza this year a lot different than last year?
So what's predominantly circulating this year is the 2009 H1N1, which was
It's
the
come
virus
back,
that,
or
well, it probably never left.
Never went away.
Never
that's
left.
what I was wondering.
Yeah, never went away.
It's, I think,
Really?
a little still too early to say with any degree of certainty, you know, what will be the predominant strain. But so far and to date, that's the predominant strain we're seeing, and seeing predominantly illness among younger middle-aged adults, which is what we saw back with the 2009 H1N1 pandemic.
Okay.
So right now, that's the predominant strain. And illness overall, I think in New Hampshire and nationally is elevated. I mean, we're seeing,
wow,
you know,
really?
a fair amount of flu activity. Hard to know if it's going to, you know, some states have seen a little bit of a dip down. We've been, you know, kind of moving between regional to widespread activity, just, you know, some evidence of flu being circulating throughout the state, or maybe more in pockets of the state. So that may change a little bit through the course of the next couple of months, so we keep an eye on it quite closely, but it's really peaking.
So you have this identified strain of H1N1. Does it change a little bit over the, you know, over years, or does it build up strength? I mean, maybe silly questions you're laughing,
No, I think,
but
and Dr.
I just
Sebeny
want to
probably could-
educate myself a little bit more as
It's
to.
a very smart virus, I think, that likes to change.
So it does change. Okay.
Yep, absolutely.
Wow.
Yep.
I mean, people say that certain illnesses, when you overdo the antibiotics, you know, those illnesses tend to build up strength and can fight the antibiotics, that you have to switch to another one. So since influenza isn't always treated with antibiotics, I was just wondering if it does change.
It does change. I mean, and you know, I think as Garrett said, you know, flu.gov is a great resource to learn more about it, because one thing we haven't even touched on is some of the other types of flu we're seeing internationally. Things like avian influenza, which has a much higher mortality rate that, you know, CDC and other, you know, international public health agencies are really keeping a close eye on.
Wow. And that is being seen where?
Well, you know, classically, avian influenza is common in Egypt. Is sort of a hotbed for it. Southeast Asia, particularly in Vietnam, is a hotbed for it. China now has a circulating avian influenza strain, and even in the United States, and I believe it was in Canada just recently, was the first confirmed North American case of avian influenza.
And that, go ahead, finish. I was starting.
No, and the point being is that, you know, those are really severely, we call them highly pathogenic, that, you know, the fatality rate with those are quite high. You know, fortunately for us, we haven't seen that at all within the United States.
And it can spread as quickly as
well, actually,
H1N1?
most of the people who get avian influenza do have contact with poultry, live poultry.
Okay.
So in those countries, you know, there's a lot of live animal markets, and people often raise chickens and other animals within their homes.
Okay.
That's generally how it's transmitted. It's less efficient in transmitting person to person. But these are things that, you know, researchers are closely looking at, because it is such a, you know, a variable year-to-year epidemiology that we see. The one other thing I'll just mention is that, you know, we talked about that if someone does have influenza and they're sick enough, they should receive, you know, antiviral. The medicine is also Tamiflu or Tamiflu. It is a very good medication for confirmed influenza, particularly influenza A, but, you know, we are seeing in some parts of the world resistance to oseltamivir. So just as, you know, the vaccine is always, you know, changing year to year, you know, there's these bigger picture issues with, you know, antiviral resistant flu strains, and so you know, they're working on, you know, developing other antiviral medications, but, you know, the bottom line is, you know, prevention is really the best effort.
It really sounds like it, because it seems like we could have a couple of different types of influenza circulating any one winter or time,
And we
right?
do this year, you know, the predominant one is the influenza A, but there's also B viruses, there's another A virus, and you know, as was mentioned, it's sort of tracked, and you sort of think about what might circulate the next year, and that's how they, you know, prepare the next year's vaccine. But there's usually a few strains, but there's usually one that sort of is the predominant or mainstream, and thus far it's that influenza A H1N1, but we're not, you know, sort of through yet. So we,
and that's why the vaccine's actually typically made up, you know, the typical influenza vaccine is what's called trivalent, so it has parts of 3 different flu viruses.
Oh, okay. So it's not just to treat the H1N1. So people should be aware that if they have a vaccine.
Yeah, one of the strains is an H3N2, and then usually an influenza B strain. You know, one thing we didn't touch on is there actually is a new quadrivalent vaccine that's also available that has a second B strain in it, so it covers 2 A's and 2 B strains, and that now is available. So you can learn more about that on the website.
Wow. So do you go, if someone comes in that has symptoms of the flu, do you try to diagnose what strain that they have, or it's all treated the same?
Generally it's treated the same. I mean, you know, most people that get the flu don't need to be hospitalized. Many people just need to push, you know, antipyretics, you know, things like Tylenol or Motrin, and, you know, pushing fluids to make sure you stay hydrated. Those are the critical pieces.
And the Tylenol, and I mean, that's just making them more comfortable?
Correct. You know,
okay, it's not really treating the flu, it's just...
It's really just, well, it's managing the headaches, the fevers, and so forth. You know, obviously what's critical, as I think most people know, is never to use aspirin in a febrile patient, you know, in the outpatient setting. So generally we recommend things like Tylenol and Motrin.
So what if someone is on an aspirin regimen?
Well, this is particularly with children. This is particularly, I'm sorry, I should have said that. This is particularly with children. So generally aspirin shouldn't be used unless it's prescribed by a doctor, really, is what we generally counsel patients. But aspirin shouldn't be used to sort of treat the fever when it comes to influenza. But if you're already on an aspirin, you can talk to your doctor about it. Most people are only on a small dose of aspirin, and children that are on aspirin for another medical condition should always be in close contact with their physician about what to do.
Right. So has there been enough vaccines this year to... treat everybody, or no shortage like there was? It seemed like in 2009 there was just a mad dash for everybody to try to get a vaccine, and maybe that was the issue. Instead of it being spread out over a couple of months, everybody wanted it as soon as the outbreak came, which...
Well, I think that was a distinct situation where it was a novel strain, a new strain of influenza, and so that vaccine had to be made in order to respond to that strain. And there was some, we didn't get all the supply we needed as quickly as we needed it, so there had to be some parsing out of those doses. But I think this year there have not been any shortages. It's been a very good supply, and as we mentioned, many options and different choices, and certainly going to a pharmacy if that's works for you, and you typically don't need an appointment. That's convenient. So there's lots of opportunity, and it really still is not too late to get vaccinated.
And what about insurance? Is that something that if you decide to go to a pharmacy that the vaccine is covered and it's easy to submit it to your insurance?
I think it is easy. I think the pharmacists have worked, with the insurer companies, and so it's a matter of providing that information, I think, to the pharmacies, and so I don't think that's been a problem at all.
Yeah, I think we want to eliminate any obstacles that may get in the way of someone going to get.
Yeah, at the pharmacy level, I think it's either the case that they can directly bill, and in my experience, I got vaccinated at the pharmacy, and I just had to fill out a simple form and submit a receipt to my insurance company, and they reimbursed me directly.
Yeah.
Great, so it's made real easy. There's no excuses.
Right.
So Garrett, how can the public maybe become a little bit more aware and involved in trying to prevent? Is it any different?
Well, certainly the preventative measures that we've talked about here today, getting vaccinated, using good cough and sneeze etiquette, washing our hands often, either with soap and water or alcohol-based hand sanitizer, and staying home if we're sick. One of the best ways to control not spreading the illness is if you are exhibiting signs or symptoms of flu, you really should be at home from work or school. And then in terms of thinking about kind of the broader community response component, in our region we have a volunteer medical reserve corps. So a corps of both clinical and non-clinical volunteers who help us in the public health response. So during H1N1, when we went out and provided these vaccination services, we brought in our medical reserve corps volunteers to help administer those vaccines. And those volunteers will be a critical component if we ever have to, and I hope we don't, but if we ever have to set up an alternate care facility to provide medical services in support of the hospital. Those volunteers would be a part of that effort. So if there are members of the community who are licensed clinicians, retired clinicians, or even if you don't have any clinical experience or background, there are ways that we can use non-clinical volunteers in these response operations as well.
Wonderful.
So they could contact the health department here in Derry at 603-845-5519 and ask for an application to become a volunteer member.
No, that's wonderful. Well, we really have covered a lot. Did we miss anything?
I would just add, we've talked a lot about, the choices with vaccine and taking measures, respiratory and cough etiquette. And, when you're out and about and you're at the supermarket or you're at the bank, I mean, there's always hand sanitizer, and there's always, so there's always those good reminders, I think, that it's an important time, and it always is, I think, to stay as healthy as possible, and washing your hands might not always be the thing that you can do right away at the supermarket or at the bank, but using hand sanitizer is a very good alternative when you can't wash with soap and water. And we say washing hands, hand washing all the time, and I know it just doesn't sound all that exciting, but it's so very effective and important.
Well, this time of year it's tough if you're washing your hands all the time and it's so cold. Your
well,
hands
and
are
you have to
getting
use
chapped and dry,
moisturizer.
so you need to have the moisturizer. So
Right.
maybe there needs to be something developed that has the hand sanitizer and the moisturizer in one.
There is.
There is?
Yes, there is. A lot of the alcohol-based gels have aloe in them. Yeah.
Oh,
Yeah,
okay.
you can get those.
Well, there you go. Because I know my hands have been getting
Mine are probably the worst.
yeah. Well, I've really learned a lot today, and I really thank you for coming in and sharing that with us. I hope you've learned a lot about influenza. Once again, my name is Suzanne Bernier Robinson. Thank you for watching Get the Facts.